Hi, everybody. This is Dr. Brett Talley Daniel, MD, and I'm a neurologist and headache doctor. Today, I'm podcasting on a subject called triptans for migraine treatment. I tell patients that triptans have headache-free data for migraine treatment in 70 to 80% of patients. Patients may be headache-free by 2 hours if they treat with a triptan at onset of their migraine. DHE has no headache-free data, but migraine nasal spray might provide relief in 61% of migraine patients at 2 hours if used at onset. Many migraine patients use over-the-counter drugs such as supplements, caffeine, NSAIDs like Aleve and Advil, or doctor-prescribed narcotics like hydrocodone and butalbital. These drugs provide a variable clinical response, and the narcotics should not be used for migraine and lead straight into medication overuse headache. But insurance coverage for triptans is spotty, and some patients don't respond or have limiting medical issues, so they cannot take them. Triptans for migraine treatment. Triptans are the first choice for acute migraine treatment. They're recommended by migraine headache authorities, and they're all generic and reasonably priced with insurance. Injectable sumatriptan 6 milligrams subcutaneous is the best all-around drug because it works in 10 minutes and gives the highest dose in the brain of medication, which is 100 milligrams. Related questions. What is the triptan response rate? About 20% of patients don't respond to triptans or have a contraindication like previous heart attack, coronary artery disease, or out-of-control hypertension. Modern treatment for migraine patients should be a trial of one or more of the triptans, the doctor adjusting the dose or trying a new drug on the follow-up clinic visit. What is the best treatment dose? Patients should always be advised to treat at onset and trying different doses using a low dose to high dose mindset. What is insurance coverage of triptans like? There are 7 triptans, and they are all generic now, and it's doubtful more will be made. Insurance coverage of triptans shouldn't be an issue, but it is a big issue in headache practice since insurance companies have what they call different tiers of drug, that's spelled TIERS, of drugs. Their tier 1 drug will be the cheapest for the patient and represents a financial deal that they have made with the pharmaceutical provider, but it's a deal that has nothing to do with the reasonable practice of medicine, where the doctor, reading the literature on headache and using his practice experience, tries to make the best drug decision for that specific patient. The rarely used triptans now are Emerge, which is called Naratriptan generic, and Exert, which is Almotriptan. Naratriptan onset is 1 to 2 hours, as is Frovatriptan, but Frovatriptan lasts the longest of any triptan, lasts 26 hours, so it has a special place in the treating of menstrual migraine. What is the best triptan? This question has never been answered. Imitrex sumatriptan was the first and has always been the most popular drug, and it comes in more applications, subcutaneously as 6 milligrams, 4 milligrams, 3 milligrams as a nasal spray at 2 doses, and 3 different sized oral pills, and also as a pill mixed with naproxen. Frovatriptan has a special place in treating menstrual migraine, but the other short-onset triptans, Maxalt, which is rizatriptan, Zomig, which is zomatriptan, and Relpax, which is elatriptan, are commonly used and are effective. The generic short-onset triptans have an onset of 30 minutes, while name-brand Imitrex and Trexamet both work in 15 minutes. Time of treatment is a big deal in the migraine world, but few patients want to pay for name-brand Imitrex or take the shot because of the rejection of needles. The question of which is the best triptan can only be answered by a large drug trial using all the drugs and seeing who wins, but now all the drugs are generic and insurance companies would have to pay for the study, so it will never be done. Imitrex sumatriptan has a duration of 2 hours, while Relpax elatriptan is advertised as the long-duration triptan at 6 hours. No journal or headache or article ever named the best drug, until 4 years ago when the American Academy of Neurology headache group broke the ice and reported the best drug overall, and that was no surprise. They named injectable subcutaneous Imitrex sumatriptan 6 milligram as the best drug. The first drug came out for migraine treatment of the triptans, and now the best. Data I've seen on Imitrex, and I don't know it for the other triptans, is that Imitrex sumatriptan subcutaneously 6 milligram works in 10 minutes, excuse me, and gives a level in the brain of 100 milligrams. Nasal spray Imitrex sumatriptan works in 10 minutes and gives a brain level of 10 milligrams. Oral form sumatriptan works in 30 minutes and gives a brain level of 30 milligrams. No surprise here. Nasal sprays give low drug levels, just the way it is. So injectable Imitrex sumatriptan works 3 times faster than oral and gives a blood level that's 3 times higher. Glaxo, the drug firm that brought out injectable Imitrex, had put all their money on the sure winner, which was, and still is, injectable subcutaneous Imitrex. The original Glaxo drug trial for FDA looked at 6, 4, and 3 milligram doses, and they're all available now and work pretty well, with decreasing incident of side effects according to the dose. For the needle shy, there is a pressure jet 6 milligram drug called Dose Pro sumatriptan, which is a system that drives sumatriptan through the skin and into the body. It's a pressure jet. A final triptan comment is that when Glaxo's name brand Imitrex ran out, they brought out Treximet, which is a combo drug of sumatriptan and naproxen. Glaxo got Treximet through the FDA because for some migraine patients, it worked better than Imitrex alone. Naproxen lasts 12 hours and is an NSAID. NSAID is N-S-A-I-D. It means non-steroidal anti-inflammatory drug. It's an eponym. After Treximet came out, naproxen was tried with all the other oral triptans and found to work better for some patients. I generally ask the patient just to try the triptan they're using first alone, but if they're not satisfied, to try it next with Tualeve, which is 400 milligrams of naproxen. Are there any new acute therapy migraine drugs? Yes, there are. There are several new drugs for acute migraine treatment available in 2020, and they are Nurtec, which is rimegepant, Ubrelvy, which is urbogepant, Rayvow, which is lasmiditan. Well, how well do the new drugs work? How well do these drugs work in comparison with triptans? These 3 drugs decrease symptoms of migraine attacks and improve function compared with placebo, and they may be helpful for the 20% of patients who are unable to take triptans. That's really their niche, or the place they should be used, I think. How do these new drugs work? They're all oral drugs. Nurtec and Ubrelvy block the CGRP receptor. CGRP is one of the inflammatory neurochemicals released by the migraine process. Rayvow works on 5-HT1E receptors, which inhibit trigeminal nerve pathways. Rayvow also inhibits release of neurotransmitters and neuropeptides. Rayvow does not cause arterial vasoconstrictions like triptans do, and can be used in patients with heart disease, stroke, and hypertension. What's the expense of these new drugs? Both sumatriptan and elatriptan are less expensive and more effective than these newer drugs. Nurtec is administered as a fast-acting, orally disintegrating, single-dosed 75 milligram tablet in patients with episodic or chronic migraine. The study demonstrated statistically significant reduction from baseline in monthly migraine days in individuals treated with rimegepant or Nurtec in comparison with placebo. Treatment provided pain relief within 1 hour. Nurtec had a sustained efficacy of pain relief lasting as long as 48 hours for many patients. This is an unusual drug in that it works quickly for acute therapy, but also has been approved for episodic and chronic migraine prevention. Ubrelvy, urbogepant, has 20% of patients who received either 50 or 100 milligrams of this drug orally had freedom from headache pain at 2 hours. The FDA approved Ubrelvy for acute therapy of migraine. Ubrelvy has no effect of vasoconstriction and is okay with heart or stroke conditions. Rayvow, called lasmiditan, is the first and only ditan for the acute treatment of migraine with or without aura. It's not indicated for the preventive treatment of migraine. Dosing has 3 oral dose size as 50, 100 milligrams, and 200 milligrams, and only 1 dose should be taken in 24 hours. However, a single dose of Rayval may cause significant driving impairment due to increased sleepiness lasting as long as 8 hours. Therefore, because of this possible side effect, patients are advised to not perform potentially hazardous activities requiring complete mental alertness, such as driving a car or operating machinery, for at least 8 hours after each dose of Rayval. Rimegepant and Urbogepant both block CGRP activity, while lasmiditan is a serotonin receptor inhibitor. All migraine patients who don't respond well to triptans, and again, as I've said earlier, that's about 20% of patients, are the ones who have a contraindication from stroke, heart disease, or high blood pressure, should discuss one of these three new drugs with their neurologist. So that's the end of this talk. God bless all you people with migraine. Please click subscribe down there so we can follow each other, and I will see you again on the next talk.